You can reverse heart and artery disease now. Greetings, this is Dr. William E. Richardson, MD, and I indeed do want to talk to you about reversing heart and artery disease. The heart has over hundreds of miles of arteries along with the body that can be damaged with hardening of the arteries, and we're going to explain all that to you today. You have angioplasties, bypass surgeries that can be avoided with my heart and artery disease reversal program. If you look at the bottom of the slide, there's a before and after of the coronary arteries. Those are the arteries that supply the heart with the oxygen and the food or sugar that it needs. With our therapies, we can indeed aid your body in removing plaque from the arteries. What we're talking about is no more bypass, no more angioplasty, no more high blood pressure, no more heart attacks, no more strokes, no more cardiac caths and stents. You can increase your circulation, increase your energy, increase your mobility, and even improve your libido. You see, heart and artery diseases are serious problems in America and the world at large. Heart and artery diseases are the #1 killers in America. There's over 1.5 million heart attacks per year. The United States leads the world in death rates from heart disease, and there are 1 million deaths per year. I want you to really understand heart and artery disease. 80% of heart attacks are painless. 40% of heart attack victims don't even survive. 50% of all deaths are due to heart and artery disease. 90 million Americans have high cholesterol, and at least 70 million Americans have high blood pressure. There are approximately 300,000 bypass surgeries per year at the cost of $135,000 each. There's approximately 250,000 angioplasties per year at $50,000 each. The total cost of heart and artery disease in America is at least $600 billion. Don't be a statistic. There was a study in Framingham, Massachusetts, heart study, and of 1,298 men and women, it was noted that they had, as they aged, a 90% chance of developing high blood pressure. Let's talk about early signs of a heart attack. Now, of course, we have pain, chest pain that is, especially in men. Women have more vague symptoms like fatigue, insomnia, shortness of breath, and indigestion. The pain in men or women may rise up into the neck, the jaw, the shoulder, or the arms. Other warning signs of a heart attack are anxiety, appetite changes, aching arms, and frequent headaches. The study that I'm referring to concluded that some people may experience undiagnosed warning signs up to 2 years before a heart attack occurs. In a study in the United States, heart disease death rates were correspondingly much higher in the Deep South, as seen on this map. All of us would like to avoid a heart transplant surgery. No one in their right mind would want bypass surgery if it wasn't really necessary. What we're talking about is bypassing the bypass. This is an example of a picture or angiogram of a blocked artery, but there's much, much more than blocked arteries that are the manifestations of hardening of the arteries, and I'll explain that to you in further slides. This picture is an example of blood clot and hardening of the arteries, rupturing. You can get enlargements of the arteries and their diameter called aneurysms. You can also get embolisms, which are pieces of plaque that fly up into the brain, giving you strokes or mini strokes of the intestines or the kidneys or any other vital organ. This is a very serious disease. The next slide demonstrates a very important principle in heart disease that most people simply do not know. That is that conventional angiography fails to visualize 95 to 99% of atherosclerotic plaque or hardening of the arteries. There are massive atheromas or atherosclerosis that lurks within the vascular wall. Most cardiologists are looking at the wrong endpoint. Their model of coronary artery disease is dead wrong. Most cardiologists are incorrectly giving their patients a clean bill of health when they have a normal stress test or a normal angiogram. Most atherosclerosis or hardening of the arteries forms in the external layers of the artery wall. Cardiologists get to see only 1% of the disease with angiogram that is killing 50% of the population and 80% of diabetics. Stress tests and angiograms do not see hardening of the arteries found by IVUS, which is intravascular ultrasound, where a wire is placed in an artery and sound waves determine the thickness of the artery wall. Furthermore, the study demonstrated that obesity and cigarette smoking were the most common factors associated with hardening of the arteries. Metabolic therapy addresses this type of insidious hardening of the arteries. Metabolic therapy affects all of the arteries, and examples of metabolic therapy include cigarette cessation, weight loss, lowering the cholesterol, and chelation therapy, exercise, etc. This is why bypass surgery and angioplasty do not decrease the chances of death from future heart attacks, but metabolic therapy does. This study has shown with using heart donor to study that there's people who passed from a car accident saying they were donating their heart. Dr. Neeson studied these hearts and found the following rates of hardening of the arteries. In Americans aged less than 20, 17% of them have hardening of the arteries. In Americans 20 to 29, 37% have hardening of the arteries. In Americans 30 to 39, it's 60%. 40 to 49, 71% of Americans have hardening of the arteries. And greater than 50 years old, it's 85% chance of having hardening of the arteries. Now I'd like to briefly discuss problems with high blood pressure medications. First of all, they don't always work. For borderline high blood pressure, they can potentially do more harm than good. They can be a cause of hip fractures. There's a large-fold increase in diabetes with some high blood pressure medications. Some other high blood pressure medications may lower the coenzyme Q10 that's needed for heart health, and many high blood pressure meds are known to decrease sexual libido. Now I'd like to discuss cholesterol-lowering medications and their problems. First of all, they don't always work. They can be liver toxic. They can and have caused cancer in mice and rats. And they definitely lower coenzyme Q10, which is linked to more heart attacks and strokes and other problems. The world was stunned again when a famous professional pitcher died at the age of 33. This was reported in 2002. The patient's father died from cardiovascular disease in his 40s, and there was warning signs only 12 hours before death. You have to remember, 2 out of 3 first heart attack victims have no previous warning, and 1 out of 3 heart attack victims die before they even reach the hospital. Heart disease is the third leading cause of death in men in their 30s. Let's discuss erectile problems related to cardiovascular disease. How's it related? Well, there was a family practice news report of a study in 2003 in Denver, Colorado, where for 25 years, men aged 30 to 69 were studied. High cholesterol, that is having a high cholesterol, meant a 93% increased risk of both erectile dysfunction and cardiovascular disease. That's like a twofold increase almost. Being overweight meant a 93% chance or higher risk of both erectile dysfunction and cardiovascular disease. Smoking meant about an 80% risk increase for both erectile dysfunction and cardiovascular disease. In the Journal of the American Medical Association in 2003, it was reported that lead exposures increase high blood pressure in men, as well as lead exposures increase high blood pressure in peri- and postmenopausal females between 40 and 59, and that's because lead is leaked from osteoporotic bones. And of course, we know how to prevent osteoporosis as well. Another study regarding heavy metals shows that cadmium, the heavy metal called cadmium actually raises the risk of breast cancer. Cadmium mimics the female hormone estrogen. Cadmium has a very dramatic effect on cell growth, both in the breast and the prostate. Cadmium exposure comes from paint, batteries, smoking, secondhand smoke, smog, shellfish, liver, etc. Some of the common heavy metals that are toxic to our systems include lead, mercury, cadmium, arsenic, aluminum, and nickel. What these heavy toxic metals do is go into our cellular system and inhibit the enzyme systems and cause free radical damage that helps cause the hardening of the arteries in the first place. Some of the symptoms and problems with heavy metal toxicity include hypertension, heart failure, poor circulation, hyperactivity, anxiety, memory loss, confusion, fatigue, weakness, gastrointestinal inflammation, ADD, heart aches, depression, and leg paralysis. There are many sources of heavy metals, especially smoking and secondhand cigarette smoke, pesticides, tap and well water, milk, processed foods, deodorants, seafood, paint, detergents, batteries, organ meats, plumbing, and cosmetics. Illnesses caused by heavy metal toxicity, again, include heart attack, stroke, circulation issues, arthritis, cancer, Alzheimer's, digestive disorders, autoimmune disease, multiple sclerosis, lupus, irritable bowel syndrome, ALS, hardening of the arteries, and tremors. I want to show you some results now of heart and artery disease reversal maneuvers in the form of disease reversal programs and chelation. Look at patient AD here with a decrease in total cholesterol from 254 to 175. The bad cholesterol, or LDL, went from 168 to 109, and the triglycerides went from 167 to 67, and the ratio improved as well, as you see. Next comes patient JT with a total cholesterol decreasing from 296 down to 146. What a great transition. The bad cholesterol, or LDL, went from 205 to 88. The cholesterol HDL ratio went from 4.6 to 2.9, and the triglycerides from 130 to 39. What a great change. The patient PW had a total cholesterol of 217. This went down to 144. The bad cholesterol, the LDL, went from 114 to 79. The triglycerides from 137 to 101. And the ratio didn't move much and is not as relevant at all because the total cholesterol is below 150. Patient SP had a transition of a weight. Look at the weight first, from 260 down to 170. Now, the initial cholesterol was not flagged as abnormal because, as you see, the 196 is less than 200, and the LDL of 125 is less than 130 on this particular lab. But as you see, we have the cholesterol drop to 131 with an LDL of 68 with a greater decrease in ratio of 2.4. Triglycerides also decrease, as you can see. What you have to understand is that the average cholesterol in rural China, where heart attacks and heart disease are very rare, is 123. The average cholesterol in America is about 220. Our final patient for the cholesterol studies is patient DW, who had strokes and high blood pressure. His total cholesterol was 327 with a bad cholesterol, or LDL, of 239. And you know that is really a lethal reading. After our intervention, the cholesterol dropped to 125. That is, the total cholesterol was 125, and the LDL, or bad cholesterol, was only 67. A notable difference indeed. Next, I want to show some examples of transitions with blood pressure. Here, the first patient, JJ, had a blood pressure of 140/90 on 2 medications. And after our intervention, the blood pressure decreased to 112/78 with no medications. Patient WW had an initial blood pressure of 140/102, and the blood pressure changed to 112/68 Well, the weight also changed on our program from 260 to 170, and that is corresponding to a 90-pound weight loss. The cholesterols were previously studied and also had a great transition. Patient LW had great results as well, with an initial blood pressure of 168/90, decreasing to 122/74. The weight decreased from 182 to 171. The total cholesterol went from 288 to 244, and the bad cholesterol went from 203 to 164. Our other high blood pressure patient, LR, had relatively normal blood pressures before and after. However, notice the medications and the cholesterol. The medications decreased from 4 to 0, and the total cholesterol decreased from 217 to 144. But the blood pressure stayed the same, but the patient was off medication. Now I want to show you a couple of patients demonstrating the restorative value of the disease reversal program and chelation therapy. In other words, normalizing or reversing hardening artery disease. Patient AB similarly shows beneficial effects. The patient had left tibial disease. Now that is blocked arteries in the foot, or the leg, I should say. And after therapy, as you can see, there was a normal artery flow in both lower extremities. So the question is, how can we solve hardened artery disease? We don't want any bypasses, angioplasties. We don't want any high blood pressure, heart attacks, strokes, and we certainly don't want cardiac catheterizations and stents. We want to know how to increase circulation, energy, mobility, and libido. So what is the solution for hardening of the arteries? 1, remove atherosclerotic plaque, and 2, cease putting the atherosclerotic plaque back in the arteries. Simple, but how? The solutions are IV EDTA chelation therapy and Dr. Richardson's disease reversal health coaching and lifestyle counseling program. That is the solution that we've been using successfully for years. My heart and artery disease reversal program centers around lifestyle changes, dietary solutions, and chelation therapy. All of those combined are definitive solutions to heart and artery disease. Chelation therapy has been around since the 1940s. It's been shown by some studies to remove atherosclerotic plaque and calcified deposits in general in the body. Also has been shown in studies to lower LDL cholesterol and dramatically improve circulation throughout the body. Apparently, chelation therapy has about an 85% success rate for heart and artery diseases, especially when combined with smoking cessation and proper diet and supplement use. Literally millions around the world have had EDTA IV chelation therapy. Chelation therapy is apparently safer than taking aspirin, and chelation therapy has been approved by the FDA for heavy metal detoxification, especially lead. Usually people need a series of 30 chelation treatments along with a good disease reversal program, meaning lifestyle changes. Chelation therapy is an intravenous drip which contains EDTA, that stands for ethylene diamine tetraacetic acid. This forms a ring that has a molecular affinity to metals around atherosclerotic plaque in the body in general. Consequently, the dissolved metals are eliminated through the kidneys and feces. Chelation therapy has been shown or observed to improve function of the kidneys, eyes, and mental faculties as well. Chelation therapy is overseen by the American Board of Chelation Therapy and the American College for the Advancement of Medicine. I have been board certified in both preventive medicine and chelation therapy, and I'm a long-standing member of the American College for the Advancement of Medicine, which is a professional group with worldwide membership that studies chelation therapy and other alternative complementary therapies worldwide. I want to show you some lab results of the chelation experience. If you look at the numbers on the left, the toxic elements were not elevated when chelation therapy was not used in this patient. So in other words, this patient initially had no chelation therapy, and the numbers indicate no increase in the excretion of the heavy metals. Then if you switch to the other side, you see that the lead and the cadmium and gallium are very, very elevated with the chelation process, because the chelation molecule literally pulls the lead and the cadmium out of the body. And we have seen previously that these are very beneficial maneuvers to rid the body of toxic elements. I have successfully administered thousands of EDTA chelation IV therapies over the last 15 years, and I want to invite you to join our very comprehensive program today. See and feel the difference.